All right, y'all, we'll go ahead and get started in the interest of time. Welcome, everybody, to the October meeting of the DuPage ROSC Council. My name's Jared. I am your ROSC coordinator. If we could start by making sure everybody's microphone is muted. If you're on here digitally, so we can kind of cut down on interruptions, that would be awesome. I do have Danny as my backup muting hatchet man, just in case. He's got a quick trigger finger, so in case you're not on the mute, that'd be great. If you have a question or comment, any point during the meeting, you can just raise your little digital hand and we will try to get to you when possible. I do want to say that this is a very special week. Tomorrow, I actually am going to be celebrating 6 years in recovery, which is kind of crazy. We got so close to having the meeting on the same day. So close. We might have to exercise the mute trigger finger. Here we go. Danny, I'm on it too. Where I got thrown off. Sorry. I think one cliche that sometimes we hear is like, if you would have told me, 5, 6, 7 years ago, I would have been here with y'all leading a council like this. I really, truly wouldn't have believed you because I didn't, or I wouldn't. Every day that I'm able to come in and work on this program with people who are just like me with lived experiences is a real honor to be able to do. And it's very inspiring. I think the people who come back month after month, the people who come to present, the people who engage with us in programs and collaborations are some of the most inspiring people that I've had a chance to work with. So it's very special to be able to have this meeting on that week. So thank you for being here with us to celebrate. So I'm going to share my screen and we're going to go over some of the things we're going to be doing today. First off, if you're new, I do like to remind people what it is that the ROSC does. So ROSC stands for Recovery-Oriented System of Care. Basically what we do, it's a coordinated network of person-centered and community-based services and supports. We really try to build on the strengths and resiliences of the individuals, families, and the overall community to help achieve recovery, improve health, wellness, and quality of life overall. It's really important that the ROSC is driven by peers, right? Driven by people who are in recovery or people who've been touched by it, people who've lost loved ones, people who have family members who have struggled with substance use challenges. These are the people that should be leading the way on these types of programs. And if there's programs being built around people in recovery, those same people should have a say in what those programs look like. So thank you for continuing to engage with us. We're coming up on, I think next month is the 3rd anniversary meeting, which is also crazy to say. So thank you to everybody who's come back month after month and moving on into year 3. So let's talk about what we're doing today. We're going to do kind of a preview of some upcoming meetings and trainings. We're going to get our usual WhatsApp referral group update from Blake. Afterwards, Danny, who used to handle the WhatsApp referral group, now handles the CORS update. We'll kind of talk about what we're doing with that program. Then my friend Mike Wood from Banyan Treatment Centers will be talking about their services over at Banyan. Matt Ashley will be talking to us about the way back in. And then Ambrosia Branson from the Circle of Care, Our House on Illinois Family Resource Center will be talking about that Circle of Care project, which is a statewide initiative that's pretty exciting and definitely something that is needed up here. And at the end, we'll have the usual time for organizational updates and all that fun stuff. So let's talk about some ROSC-specific things that are going on. The next item drive is our, I think it's annual at this point, winter coat drive. So we are looking for coat donations through the first week of November for People's Resource Center. Please make sure everyone is muted, please. Thank you. Donations can be dropped off at Serenity House. That's over here in Addison, 891 South Rawling Road. Looking for like lightly used stuff of all sizes. So for men, women, children, whatever you've got, we would love to have it. People's Resource Center is a great social service organization, and they've been a great partner for donation drives we've done in the past. I think we've done a winter coat drive. We've done a sock drive. They're always very grateful to have these things dropped off for them. And you guys always come through with great donations. So check those closets. If you've got some stuff you'd be willing to donate, come and drop them off at Serenity, or you can make some separate arrangements just by contacting me and we can work something out. So yeah, Looking forward to getting some of those donations. Peer recovery support specialist support group. That is a mouthful. But this is the first and third Wednesday of every month on Zoom. We started this meeting for a couple different reasons. Recovery support specialists are kind of a burgeoning area of this field, not only through the local colleges like COD, Elgin Community College, Governor State. We're also doing our own training, which I'll mention here in a minute, but more and more people are entering the field as a recovery support specialist. And so as people with lived experience, sometimes we realize that those of us working in peer support kind of need our own support meeting. And so we started this about a month and a half ago, and it is on the first and third Wednesday of every month on Zoom at 7 p.m. Everyone's welcome. Come talk about the job if you're already working in the field. Students are very much welcome. We'd really like to offer and extend that invitation. So if you're a student who's maybe trying to go for the certification, you can come and hang out with us, kind of learn a little bit about some of the work that's being done. We're there to answer questions. We're here to talk about what worked, what didn't work, and hopefully can get some good info to people who are looking to get that certification. So that is completely open, first and third Wednesday of every month. Speaking of recovery coaching, our sister organization, the DuPage RCO, of which Danielle is our coordinator, and she is on vacation right now, but I'm happy to talk about the recovery coaching services that we provide free of charge through grants, not only for mental health and substance use challenges. We do non-clinical stuff, right? We meet with people in a non-clinical setting. We can help them navigate some of those early things with recovery, because there's a lot that goes into early recovery that's not just the substances, right? There's stuff like Serenity House, when we have clients come in, a lot of them don't have ID, or maybe they haven't worked in a long time. Maybe they have housing insecurity from when they're leaving here. There's a lot of things that go along in early recovery besides just the substances, and coaches are there to kind of help along with that. So we are providing that free of charge. You can see some contact info up there if that's something you're interested in. Danny is going to talk a little bit more about that course program that provides some of this deployment of coaches. And you can definitely reach out to him to set up some meetings. We would love to come out and talk with you about if this is a type of service that your clients could benefit from. So I did mention that Recovery Coach Academy. I think it's been a little while since we've done one of these, but these are really, really cool. We've done a few of them since the ROSC has started. This is through the Connecticut Community of Addiction and Recovery. We do this on 3 consecutive weekends. So these are here at Serenity House. Our grant writer, Holly, leads these. She's fantastic. So it's on a Friday night and a Saturday morning. So you can see up there, Friday, November 1st is the first one from 6 p.m. to 10. And then the next morning from 10 a.m. to 4 p.m. So it's 3 consecutive weekends like that. And that takes care of all 30 CEUs or contact hours. And then we can hopefully give you some guidance on the next steps, right? Where you can possibly go to do internships, to do practical hours that are needed for certification. The only cost is actually materials cost. And that is a pretty cheap proposition. I put the flyer up here on the screen with the QR code. I'll be sending this out to you and blasting it through social media, but space is limited. So this is something you're interested in. Try to jump on it soon because we usually do have spaces fill up pretty quickly. So if you're interested in that, come on down. Couple more things. Every third Thursday of the month, we do a virtual Narcan training. We do all kinds of Narcan trainings. We're out in the community doing them, but we also wanted to offer a virtual option. So we do this on the third Thursday on Zoom. This is good for basically like a Narcan 101. So you got a family member who has no idea what Narcan is, no idea how to use it. This might be a good training for them because it's kind of that, Narcan overdose, how to spot overdose 101. But we also talk about trends that we see as people kind of out, boots on the ground working in this field. So things like obviously the fentanyl crisis, xylazine, and some other adulterants that have been showing up, but also talking about other trends, right? The overdoses are going down, but how far down are they going? Where are we finding the most overdoses, things like that. So everyone is free to attend that one, third Thursday of every month. And lastly, I do want to hand the wireless mic to my colleague, Blake. You can come on down. Now, I mentioned earlier that Blake has now been passed the torch of the WhatsApp referral hub. Danny Sorbis did it for us for, was it a year and a half? a year and a half, and he did a great job. And we know Blake will do an even more amazing job. So he's gonna just kind of check in on some of the work that's been going on in there. And then what do we have a name for it? Referral Hub Refer of the Month. We got to find a catchy name
Referral
for it.
MVP is our general title right now, but we can
Referral
think of
Hub
something better.
MVP. Okay. So Blake, let us know what's been going on in the Referral Hub.
All right, good afternoon, everyone. First off, thank you to everyone who has been a part of the referral hub. We are now up to 125 members. This month, we were joined by members of the following organizations: City of Wheaton, School District 211, NAMI Metro Suburban, Blue Kite Wellness. We have several students at COD, Will County Health Department, Becker Center, Healthcare Alternative Systems, and Convention Psychiatry and Counseling. This month, we have provided referrals for recovery coaching, sober living, shelters, inpatient that accepts clients without insurance, an inpatient facility that treats both addiction and mental health, inpatient referrals, outpatient referrals, and sober living that accepts clients who use medical cannabis. And now it's time to announce our referral MVP.
Drum roll, everybody. Drum roll.
This is this is the individual who provided the most referrals this month, and that is Lindsay Hartman with the Association for Individual Development, otherwise known as AID. This month, we are starting a gift card for you. So I will reach out to you and work on getting you your gift card.
So if anybody here didn't hear that just because of noise, we are starting well, we've been doing the monthly winner in the referral hub for a while, but we're now going to be sending out gift cards to the winner. So I think the real winners are the people getting the referrals on the referral hub, but it's still nice to have, a little bit of engagement bait. So thank you to everybody who uses that. For those of you who don't know, we get asked questions about this thing from ROSC and RCOs throughout the state. So I think it's a really effective model to keep people from falling through gaps. So if you're somebody that works for an organization, or maybe you're just that person in your group who people know are in recovery, and you're the one that gets those phone calls about, hey, I got a friend that's looking for treatment. How do we get him a bed? Join the referral hub. Super, super easy to use, very, very non-invasive, and you could get a pretty cool gift card. So I'm going to go ahead and now turn it over to Danny Sorbis. So you want to hand that mic over to Danny. And Danny is going to talk about the CORS program that he's heading up. I did mention that recovery coaching stuff earlier. He might go to a little bit more in depth here about the stuff he's doing with that. So Danny, go right ahead.
All right. Good afternoon, everyone. Just a brief overview of CORS.
I may ask you to turn this way a little bit so people back there can hear you too.
Let's do it this way. All right. Good afternoon, everyone.
It's two audiences. I'm sorry, guys.
No worries. No worries. So CORS stands for Community Outreach and Recovery Support. My priority population are those who are unhoused, at risk of being unhoused, have opioid or substance use disorders, or other mental health challenges that go along with that, are at risk for medical complications, incarceration, and overdose. So in order to do that, we have a few objectives. We do harm reduction, so Narcan training, distribution, and education. We also do referrals. So we just talked about the referral hub. On top of just referring to treatment and doing warm handoffs, we also do referring to coaching. So coaching services is something that we're specializing in. Jared talked about it earlier with the RCO. We do the same kind of thing. There's no judgment. We meet people where they're at. They don't have to be sober. If they want recovery to take those steps, we will help them with that. If they are still using, we're still going to be there to support them. So we're going to be doing that in person and virtually, depending on how we can work it out. If you have any questions, I'll put my email in the chat, and I would love to talk to you further.
Thank you, Danny. Now, I do want to introduce someone. She's sitting right behind you. I'm sorry for putting you on the spot, but I forgot to do the smooth transition. I'm sorry, a lot going on today. I should have mentioned that Blake, like me, came through this house. He's actually kind of done a lot of the same things I did. He was a house manager. Now he is then he was a senior resident here. But he's also doing work with us through the grant with Recovery Corps. Our other Recovery Corps member that is joining us is Annette. And so I wanted to put her on the spot and introduce her and maybe let her say a couple things about herself, because you'll be seeing her around over the next few months. So Annette, sorry again. Go right
No
ahead.
problem. Hi, everyone. Again, I'm Annette Villarreal. I am here with Recovery Core. I will be the new recovery, the new recovery project coordinator, and I'm excited to be here. A fun fact about me is that I love to golf. I'm a big golfer, even though you see I'm 4'11", but I'm a big golfer. And secondly, I love to rescue dogs, but mainly I rescue mastiffs. So I've had vast experience with very huge, big, lovable dogs.
Beautiful. Welcome, Annette. Yeah, you
Thank
can bring
you.
it up here if you want. When you said golf, Mike Wood's eyes got about as wide as humanly possible. So you may have someone trying to get you to go to some golf outings at some point. Okay, so thank you everybody for letting us do the housekeeping stuff. There will be time at the end to promote some other things from different organizations, but I do want to get to our first guest. So I'm going to stop this particular share for a second. Forgive me if I get sappy for a second, but to get to our program spotlights, I think it was like God or the universe lining up this first guest to join us on this day, the day before I actually celebrated a 6-year milestone personally, because this guy knew me back before then. Mike Wood is somebody I've known for a few years now. So he knew me when I was struggling. And I think maybe you knew me as the guy that was friends with people, but was still using, couldn't get it right. And you guys were just waiting for me to get it right so I could come and work in the field with y'all. And it actually happened. I'm still shocked when I think about that. Point being, this is somebody that I looked up to. So to be able to sit in a situation in a meeting like this as a friend, but especially like as a peer is pretty amazing. So he was always somebody that I looked up to, and I used to say, I'm going to catch up to you at some point. And I'm still trying. But that's my friend Mike Wood, who heads up business development over at Banyan Treatment Centers. A lot of you probably know him. He is the king of networking and getting out there and talking about the services. So if you don't know him, you're about to know him, and I'm going to hand him this mic to talk a little bit about Banyan Treatment Centers out here in Greater Illinois. So Mike,
do that.
welcome.
That too. There's I think I'm out of the screen, but I don't, everybody can hear me. I think we'll be okay, right? Can you guys hear me back there? I got a voice that carries. So yeah, so thank you so much. One, I didn't write that introduction for Jared, so he's, but I appreciate that more than you know. And like the men and women that came before me in recovery, I think there's an old saying that there's a seat waiting for somebody. And that couldn't be more true. So as Jared talked about, I'm in long-term recovery myself. There's my sobriety date's November 7th, 2013. Forever grateful for that day. And yeah, along the way, I've met some amazing people, been a part of some amazing organizations. And guys, here's the thing, right? We don't do this perfectly, but when we come together, we do this really well. And so it's an honor. So Banyan Treatment Center, as you see on the screen, there's Banyan Treatment Center. For those of you that don't know, has sort of been a staple within the DuPage County area. Really, one of the people that helped launch Banyan Treatment Center in the Chicagoland area is a guy named Brad Gerke, who many of you are familiar with. So Brad's been a part of Banyan for years, him and his wife, Jess. We have many of the people that work at Banyan or for Banyan are also in recovery themselves. So Banyan nationwide, I'll start with that and then I'll bring it to the glimpse of Illinois. So Banyan nationwide, we have 18 facilities in 10 different states. We have primary mental health disorder programs. We have a specific veterans program. So by specific, I mean it's veterans, first responders only in Massachusetts. Every other Banyan location has a track for veterans, but in Massachusetts, it's specific. Like they go by military time. There's no civilians in the milieu. It is specific for first responders and for veterans, and it's ran by first responders and veterans. So with that, obviously, I'm sure you guys have noticed that there's a hurricane happening in Florida. So we have a lot going on in Florida. We have 6 programs alone in Florida that cover primary mental health disorders, substance use disorders. Banyan got its I guess its name, there's from the tree. So if you know the banyan tree, you know why sort of you see many treatment centers with that symbol is because the symbolism is something that grows very mighty and strong out of like darkness and sort of chaos in the swells of the swamp. So that's what we do. We meet people right where they're at. We have our locations in Illinois. So we have a place called Banyan Heartland, which is in Gilman, Illinois. Anybody know where Gilman is? Nope. Nobody does. Very, very low AMA rate. There is very, very low. So Gilman
So you're
is
saying there's
south.
nowhere to go if you
There's
try
nowhere to
escape.
go, which is we got them right where we want them. So Gilman is south of Kankakee. We provide transportation to anybody who's a fit for our services and who's admitting into our care. That's where our detox residential is located. So there's usually our average length of stay is anywhere. If somebody's doing detox only, we will help them. We highly recommend against it, but if that's all that they'll take, we'll give it to them. So detox usually about 5 to 7 days, and then 21 to 28 days for residential level of care. And then we branch out to our Naperville location, which is literally the heart of downtown Naperville, where we have a PHP program, which there's also a PHP with housing, and then an IOP. To extend off of that, we also have a virtual IOP program at Banyan. So anywhere where we have a brick and mortar, so Illinois, Florida, Massachusetts, Pennsylvania, Alaska, California, Texas, Colorado, and soon to be North Carolina, anywhere we have a program with a licensure, we are equipped to do virtual intensive outpatient. So, which obviously in post-COVID, that goes a long way, and there's people that are more comfortable. So again, trying to meet people where they're at. To extend off of that, there's one of the things that I boast of the most that I think you guys should know is we have family coaches. So when somebody admits within 48 hours, their family member or their emergency contact will be reached out to by a coach, not to be confused with a therapist, because we branch out for marriage and family therapy and things like that. But a family coach, and then we have an alumni program. The alumni program is run by Jess Gerke, in which we are in constant contact with our people. Because obviously, here's the thing, and here's what many of us learned in the treatment setting. Treatment is a place where you build a foundation, and then you start building the house after you leave treatment. So you get a bunch of tools, you're equipped. Our client to therapist ratio, so each therapist will hold a caseload of 7 to 9. So if you've been in the industry or you've worked in a treatment setting, you know that's very minimal, but that just gives therapists the opportunity to do a ton more work with an individual. So we're really grateful for that because we know it's a launching point. So we're not a bells and whistles type of place, and we don't have the shiny, glowy things and be attracted to us. We're a get in the trenches type of place. We do have workout areas. We do have like yoga. We have a holistic treatment model. But in the same way, we also know that our goal is to get people to be complete functioning members of society, first and foremost in their homes, in their occupations, and in their surrounding affairs. So that's the goal at Banyan. I don't know how much you need from me. I think that's good for the time being.
I mean, I think if anyone can see that photo of Banyan Heartland, I always wanted to go to a treatment center like that looks like it's in a ski cabin that looks incredibly cozy. How long can they stay? What's the length of stay for residential?
So residential is usually between 21 and 28 days, and there's room. It's the strange in this, like case by case, right? But usually the average length of stay, and that's if you're factoring detox into that.
The other thing I wanted to bring up, which I have seen Mike do dozens of times, which is he is always ready to try and find beds for people. And if it's not with them, he will do what he can to find the place for them, right? I mean, and that's the way that we really should be approaching this, which is, we try to fill beds when we can at our own places, but we also know when someone's ready to go, we got to find them someplace, right?
Yeah, absolutely. And to touch on that, so I was brought up spiritually, and even like I grew up in a single mother home, and my mom, there's we brought in a lot of strays. There's we brought in a lot of people that she just loved on. So I had seen that firsthand, but then I grew up in a lineage within the fellowship of just a man and other men that were just servants first. And I think that's like when with the referral app and everything, I think it's pretty incredible that it's more about collaboration rather than like competition. And that's a beautiful thing that we all get to be a part of. I'm happy to extend out, like if anybody wants to meet for coffee or lunch, or if there's a way that we can just connect further, sort of beyond this, I'm happy to do it. So I'd love to meet with you guys and sort of see where your hearts are and see if there's anything we can do together.
Also, before I open it up for if anybody has questions, do you mind touching on Spiritual Care Network for people who might not know what that is?
Absolutely. So Spiritual Care Network is we meet every month. And basically, so all faith backgrounds are welcomed. We're a primarily Christian organization, so you'll hear about Jesus a ton. But we have it's professionals, people that are in business development. It's church leaders. It's community leaders, first responders, and basically our goal and the thing that was sort of laid on me and a couple people on our hearts is we want to bridge the gap so between the church and the mental health world. I don't know if you guys know this, there's a pretty big chasm. So we want to be able to bridge that gap, which we're finding we're seeing growth. We're seeing people being attracted to it. We have a dynamic speaker that's coming up that owns and operates a place called Heritage Counseling out of Wheaton. That's he's going to be. We always do a topical discussion, and so it's every fourth Thursday of the month. November and December will be different dates. Obviously, Thanksgiving, Christmas. But yeah, beautiful thing. Jared's come and been a part of it. If you want to come join us, feel free to reach out to me again.
Heck yeah. Brittany, I see your digital hand. Do you have a question about any of that?
I do. I'm first of all, I'm Brittany. I'm the ROSC, one of the ROSC coordinators for Macoupin and Montgomery County. And I love the whole Banyan thing. I'm always looking for resources for inpatient care. And I was wondering, I think I missed it. I think you said something about having or offering rides to your inpatient locations. And if that is the case, how far does your reach go?
So yes, we provide transportation. And it'll be within 4 to 6 hours of the location. So
Wow.
yeah, so it'll be, but it's starting to get to that puts somebody on the road for about 12 hours. So that gets a little
Mhm.
dicey. What we'll usually do is we'll team up with a client and say, hey, can your mother, wife, husband, spouse, brother, sister, dogs, aunts, masters, uncle, whatever it is, can you have somebody come and meet us, a couple hours? But so Southern Wisconsin, Indiana, like the territories that I oversee, we basically go to Missouri, Wisconsin, Indiana, Ohio, like the western part of Ohio. So yeah, we can provide transportation for anybody in the state of Illinois.
That's a really great because, as you know, a lot of times with
I'm
mental
gonna
health
go grab
and
Caleb. I'm gonna go grab Caleb.
Okay. Could everyone mute if you're not muted besides Brittany? Thank you.
sorry, with
You're good.
mental health and substance use, transportation is a really big issue, and that's one of the things that our Ross Council is going to be focusing on at the beginning of the new year. But we're always that we do have some inpatient places around us that do offer different types of treatment and things like that, but right now we have a really big unhoused population and they're always kind of on the road. They are very transient beings, and so having this information and having that resource to give to them, maybe if they were to even able to find a way closer or within that 4 to 6 hour reach, that could just be huge for them. So I really appreciate what you guys are doing, and I appreciate the resource.
Absolutely. And if something were to, so when it comes to transportation, right, we have a window. we have a window of opportunity when somebody's saying yes to treatment, because
Right.
otherwise as an addict myself, we think our way out of it. And
Right.
so the beautiful thing with that is like we'll get on top of it very rapidly. And so our process from like first phone call to having a ride on its way is usually about an hour, hour and a half. And it's a lot of it is because our clinical medical review. We don't want to bring somebody in just to fill a bed. So
Right.
we're gonna make sure it's the right level of care. If they're too high acuity for us, then they're gonna reach out to me and say, "Hey, Mike, we need to, it wouldn't be right of us to bring this guy in." So
Sure.
then we'll reach out. So there's so to just build on your point a little bit, we try to cover all ends because we know exactly where somebody's at when they're in that crisis state.
Right. Sure. Thank you so
Brittany.
much. I appreciate it.
We got time for one more question. Our friend Christy from New Directions. Christy, you got a question or comment?
Yeah, thank you. I was just curious if Banyan takes Medicaid, and if so, which ones, or Medicare?
So Medicare, we don't take. Medicaid. We do not take. There's with Medicaid people that I've worked with, there's a couple ways, and it's strange. So we have contracts built up with a lot of either nonprofits or probation departments or sort of state programs. So if somebody's on Medicaid and they're a part of one of those entities, we can usually get them into treatment under sort of like an opiate use settlement that has treatment allocation funds. And we get basically a Medicaid rate provided through contract, and then we're able to treat people through that.
So we would already know if we were part of that. So that's only the nonprofit.
Correct. So I
that
know
you
New
already have.
Directions, which Christy, I'd love to meet with you and talk more. But I know New Directions is not a part of it. So like Lake
Okay.
County probate, because you guys are in Lake County, correct?
No, we're in McHenry County.
Okay.
I just
so
wanted to
was
know
gonna-
if you did take Medicaid now, just checking, because we predominantly help people that are probably 75 to 80% is Medicaid. So
Yeah, I totally get it. I got sober with no funds and I didn't even have
Same
Medicaid.
here.
Yeah, so I didn't even have Medicaid. I was just thirsty for change. But
Yeah.
it breaks my heart a little bit when that part gets brought up. So, but yeah, there's so like Lake County probation, we have a contract with. There's some other
Okay.
places that we have contracts built out with.
Okay, great. Thank you.
Thanks, Christy. And we got two more presenters, so I do want to move on. If anybody has questions for Mike, in person, just hang around. I'm sure he can chat with you afterwards, or I'd be happy to share his contact info, afterwards as well. So Mike, thank you, buddy. Appreciate it. I love you. Keep coming back. I'm going to stop my share. I do want to turn it over to another return guest, somebody who comes every month, or at least it seems like he's here every month, which is Matt Ashley from Way Back In. If you have worked in this field, in this area, the Way Back In, you are probably very well aware of them. They have been doing their thing in this area with sober living and other services for quite a while. I did want to have them here to kind of talk a little bit about their services and how to access those. And so I do want to turn it over now to Matt. So Matt, I'm going to give it over to you, and then we'll hopefully have a couple minutes for maybe questions or comments at the end.
Okay, thank you. As some of you may have already heard, Jared and I were already speaking, that I'm not really much of a presenter. So this is kind of my first time doing this. Can you see the screen?
We can.
All
and
right.
we're big supporters, Matt. We're gonna.
I got
getting
one
behind
check
you
off.
here.
I got on the screen, so we're off to a good start. So yeah, so anyone who is unfamiliar, I work for Way Back In here in Maywood, Illinois, kind of the outskirts of the west side of Chicago. That is where the men's ERC location is. Our women's ERC location is in Oak Park, Illinois. So in a nutshell, we are a long-term residential treatment program for drugs, alcohol, and problem gambling. We have a very structured living environment, and all of our clients are required to work full-time, or at least as close to full-time as possible, and we do prefer first shift. They go out and find a job. They do not work here with us. Our initial program is roughly 3 to 4 months. However, depending on how clients do in our program, things like that, we do have a step down program. So it's really not uncommon for some clients to be with us for 12 to 15 months sometimes. We do have clinical staff here, so all clients are attending both individual and group counseling sessions, as well as attending 12-step meetings, working with a 12-step sponsor. And just for a favor to me, if we are bringing some clients over to us from your organizations, please let them know that we are a smoke-free campus and it must be done off property. And we also hold on to clients' cell phones while they are on property. We have a landline they can use, contact any loved ones they like. When they're out job searching or working, they're allowed to take their cell phones with them. Right. So really the only thing on here that I kind of wanted to bring up is the medical monitor is we are not a medical facility. The only thing that we kind of provide really is we work with a psychiatrist named Dr. Cabuso. We've been working with her for 10 years plus, probably longer. So once a month, she comes in via Zoom and meets with any clients that would like to, talk to her about medications, on and off, refills, stuff like that. Luckily, we are in a very good location, so there are, if anything does happen, we are in a very good location because there's like 2 hospitals very close to us. So if anything goes down, injury, relapse, anything like that, they have to go get medically cleared or, get taken care of because we are in fact not a medical facility. So the ambulance drivers love us. Some of our services, so as I said, so I like to think of us as kind of an extension of a 28-day program. And so a lot of the clients come with us, they go into our ERC program. Pretty much, like I said, we are very structured, so they have to, bed made at 7:45, 8 a.m. They're out job searching. They can go to a computer lab because everything is kind of electronic now. I like the old school version when you went door to door. But they do have to find employment within 30 days. We do not necessarily accept payments up front. So we give them about 30 days to kind of fulfill that 30-day obligation of kind of paying that first month's rent. But we understand that people are coming from us from a detox or a 28-day program. So we give them a little bit of leeway. Here we try to give them the benefit of the doubt of rebuilding their lives. And some of us come here with sometimes literally nothing. So 8 a.m. they go out and a job search, and most of the treatment stuff is kind of after 5 o'clock. 5 o'clock community meeting, 10-15 minutes. What's going on with the house? They come in, they eat a meal. They eat better meals than I have in my entire life. I'm a little jealous. And then 6 o'clock, Tuesdays and Thursdays, they have group from 6 to 9. Mondays, Wednesdays, Fridays, it's meetings or working with a sponsor. Saturday mornings, group. So we keep them busy for sure. That's why we don't allow cell phones while they're on property, because when they're on property, we really find it beneficial that they focus on themselves and in their early recovery. So that the ERC program, like I said, is roughly 3 to 4 months, sometimes a little more, depending on case by case basis. After that, if they are still interested in kind of staying with us, we do have a recovery home in Melrose Park, 4-minute walk from here. We have an apartment building, so they're still a part of the way back in program, but we give them a little bit of leeway. They have to, one less group, one less meeting, more time to work if they want, more family time if they want. When they're in the ERC program, we keep them pretty close to the chest. They're out job searching or working, and then they're back here for the treatment. Recover home's a little bit different. They want to go get tacos, they just go get tacos. And after that, hopefully with all the time that they've spent with us, they're saving money. They work with their primary counselor about financials and stuff like that. So hopefully after about a year, or so, then they're hopefully ready to go, and they're can get an apartment and keep living with the people that they've built a recovery support network with here. So we do have we do work with a little bit of the families and stuff like that. That's always an option if a client here wants to, like, have meet with the parents or significant others, anything like that. That's something that we can do with the clinicians here. Yeah, pretty much about that. Yes, being that we are we're a treatment center, but they look like houses. If you ever see any of our properties, they look like houses. So it is very important that that when they come in here, everyone's assigned a chore, keeping ourselves clean and hygiene's up to par and everything is good to go. Laundry, everybody has a laundry schedule and all that. Laundry's free. Work pretty much just building the structure that when we're out there, we kind of lose. We hear a common complaint that we're not children, but I know when I was out there, I needed the structure because I lost everything. I didn't push in chairs. I didn't make my bed, nothing. So it was always helpful to me to kind of always literally write down what I'm doing. Sometimes every half an hour, every hour. What am I doing? Staying present in the moment, what's going on. When you come in the house, take your hat off. You don't need a baseball hat inside the house. There's no sun. You know what I mean? Being present is kind of huge to us here in early recovery, of being aware of what you're doing every single moment of the day. Hygiene, cleaning up after yourselves, helping others clean up after themselves. We have what's called, pull-ups or push-ups, where someone leaves a dish in the sink, you give them a respectful push-up and you will accept it respectfully, because we are luckily rat and mice free. We try to keep it that way. Outcomes of behavioral therapy. Yeah, we just try to get back into being mindful and form responsibility. We're going on a one-way track when we're out there the whole time, sometimes 5, 10, 15, 20 years of going hard, and then out of nowhere, your body, you want to make the change, or your body is forcing you to make the change, or somebody else is making you the change, and now we have to go backwards, and that's very difficult when we've been heading in one direction for a long time. So we really try to work with them as best as we can, of just forming teamworks with the staff here, with each other. Still to this day, I actually went to the Wayback Inn many, many years ago. I still speak with some of the guys in the house today that, even if it's just playing Call of Duty, that's still a bud, and they can tell when you're off. You know what I mean? You have a good day today, man. You're all off, Sober buddies all around, and it's very important to us to start building sober networks. Luckily, we're like next to the Oak Park area, right next door, and it is a huge 12-step AA community over here. I can't go into any town around here and not spot somebody that I've seen somewhere. It's very, very cool. So it's almost kind of like a dome within a dome. Very awesome.
Hey, Matt, not to rush you at all. We got a couple of minutes. I want to just be cognizant of the last presenter. If someone needs to access the services, what's the best way to do that? So like if we need somebody that needs to get in, what's the best way to do that?
I can write down the intake phone number, and they can always just reach out to me.
Is that kind of the best way to do that?
To get someone into our program, absolutely.
Okay. I also wanted to leave another minute or two. Did anybody have any questions about the program? Questions or comments about Wayback Inn? Well, Matt, if you don't mind sharing your slides with us, I'm going to go ahead. If you don't mind, I'm going to send it out to people afterwards. So if they want to access any of this or know how to contact, I would love to do that. So thank you for making the time for us. Let me tell you, you did way better than I did my first presentation.
I just tried to talk way more because I'm like, how am I going to fill 10 minutes? I don't know how I'm going to do this.
You did a great job. Thank
All
you
right,
for
well-
always coming to our meetings and taking part and
Oh,
engaging. We appreciate you as a member and as an organization. So thank you, Matt, and hopefully we'll see you month after month. So we appreciate it.
That's not a problem. Thank you for having me.
Yeah. All right. Last up, last presentation. I did want to welcome Ambrosia Branson, who actually Danny and I met with recently, who's a project coordinator for Circle of Care, which is a statewide program created in collaboration between the Illinois Family Resource Center and Our House, which is further downstate. I'm going to let her go into it, obviously more in depth, but kind of designed to support children, youth, and families dealing with grief and loss due to substance use related deaths and disorders. Something we could definitely use some help with up here in DuPage. And I'm sure all the counties around us could definitely use the help as well. So Ambrosia, I'm going to turn it over to you to talk a little bit more about Circle of Care. And if you need me to make it coast, if you have a visual, cool. If not, that's cool.
Yeah, I actually do have just a little PowerPoint I can go through pretty fast for us just to be very conscious of everyone's time. Perfect. But thank you guys so much. I actually did want to talk about just for a second. I previously worked with one of the ROSC councils in the state of Illinois, so I do recognize some faces on here. But I previously was the Edgar County ROSC coordinator before I transitioned into this new position with the Our House. And whenever I was with the Edgar County ROSC, I remember hearing about this other ROSC council that was doing this awesome thing with WhatsApp and had this like referral hub. And so I just wanted to say kudos to you guys for really, taking the initiative, starting that in your guys' community and doing the work and getting people connected to the resources that it is that they may need. So I just wanted to punch that out there as well, that I've heard about you guys, the DuPage County ROSC, the wonderful things that you guys are doing. But on another note, I'll just share, and I'll probably just go pretty fast through these slides. But as Jarrett was saying, I was able to meet with him and Danny and talk a little bit about this new program called the Circle of Care. So like he said, our program is created in partnership with the Illinois Family Resource Center, which I see Christina on here today as she is a part of the IFRC. And then both of our programs, our lead agency is the Our House in Charleston, which is a substance use disorder treatment facility. And so really with our program, we're dedicated to being able to provide that support for children, youth, and families who are grieving loss due to substance use related death and disorders. So this program really came to be from the wonderful work that the Illinois Family Resource Center has been able to do over the past 10 years and really shining a light on the lack of resources and supports that we have for children who are experiencing or impacted by parental or caregivers substance use disorder or substance use related death. So we're a 1-year statewide grant funded project through the Illinois Department of Human Services Division of Substance Use Prevention and Recovery. We're again only here for a year, so we were able to get some federal dollars that trickled down from the American Rescue Plan Act that allowed for us to be here today. So after the 1 year is over, Christina and Nancy are going to be taking on, the sustainability of the Circle of Care. So everything that we've created in our 1 year are going to be housed on the Illinois Family Resource Center website, all of the materials, resources, and things of that sort, and they will keep that going. So if you guys can take anything away today from what I'm telling you about the Circle of Care, it's this. Really what we're aiming to do is build this network of grief and substance use disorder resources for not only our children and teens who are impacted by parental or caregiver substance use related death or disorders, but we're wanting to train our natural helpers or people in communities that naturally interact with kiddos within their everyday personal lives or professional lives. So, that's looking at people who do volunteer work with kiddos. Maybe they work at their local YMCA or for a youth serving organization, looking at our educators, healthcare and first responders, law enforcement, our social service agencies, our treatment agencies, our recovery community organizations, just family members or the next door neighbor that kiddo has. Really everyone in a community somehow naturally interacts with kiddos. So we want to be able to train and equip them on how to best respond confidently and comfortably to that grief that kiddo may be experiencing. So we have technically 4.5 components to our project, which you can kind of see here, which again, I'll go kind of fast for us, but we are going to be creating a grief support services directory. So we do have a researcher on our team, and what she's looking at doing right now is looking at what are the current clinical and non-clinical grief support services, resources, and supports that we have for children and teens in the state of Illinois. And so we're going to be collecting all of this research. Once we get all of this research collected, we're looking at the end of December. We are going to upload our very comprehensive online grief support services directory, and it'll be found on the Illinois Family Resource Center website, which is illinoisfamilyresources.org. And so I'll go fast through these next couple of slides, but we were able to do close up phase 1 of our research, which looked at what are the number of licensed clinical professionals that we have in the state of Illinois that advertise they treat or specialize in child and youth grief. And so one of the things I like to throw in here is we go by the same map that the ROSCs go by, so the IDHS super regional map. And so what we were able to find is Region 1, Cook County, 118 of our providers are housed there, while our state total, looking at the whole state of Illinois, we have 243 licensed professionals that advertise they specialize or treat child and youth grief. So really from this data, we were able to find there's a huge gap, in regards to like service area. Specifically looking at Region 4, which is like Springfield, Sangamon County and over. I think someone said they're with the Macoupin, Montgomery County ROSC. So this is across your region, as well as the Our House. We are housed in Region 4, but what we were able to find is 17 of our licensed professionals are in Sangamon County or in Region 4, with 13 of them specifically in Sangamon County or Springfield area. So we were able to see, and you can see from this map right here, the distribution of services is very much not very well representative of our whole state of Illinois. So the second phase of our research is looking at, well, who are those non-clinical grief supports and resources that we have in community? So if there are grief support groups for kiddos going on, or bereavement camps for kiddos, or if there are I'm trying to think of the hospice organization that does some type of grief support for children or teens. We're asking our community members help in identifying those resources so we can add it to our directory and database. So it's very comprehensive for people trying to navigate, if they do have a kiddo that comes into contact with them, saying, what resources and supports are out there and what's near me. The second component to our project, we're going to be doing some online resource toolkits. So we're going to be creating 21 of these toolkits that essentially, we have 7 sectors that we feel encompass a community based on the purpose of our project and those that naturally interact with kiddos. So we're going to be creating these toolkits based on the sector and the developmental age of the child, and they're going to have resources in there to, again, equip our natural helpers to be able to respond to that child's grief. So being able to educate them, as well as giving them like experiential components and tools to be able to do with kiddos. We are going to be doing some grief and substance use disorder specific trainings. They're going to be called the Threads of Hope training, weaving support for children grieving a substance use related death. So again, with our trainings, we're wanting to have that educational aspect and recognizing that we're bringing in people from various sectors that have various knowledge, background, and expertise surrounding grief and substance use disorder. So, we're going to be providing education on what does grief look like? What is substance use disorder? What is mental health? What do the family dynamics look like? And how does all of this come back and impact the child? And then we're going to be, having a lot of experiential components and teaching people the tools and strategies on how they can navigate stigma in their communities, how they can break down that stigma and shame and guilt that kiddos may experience, living in a household with a parent that has a substance use disorder, or, that grief and loss that they experience if they have lost a parent or caregiver due to a substance use related death. And so and I will send all of this stuff out to Jarrett with like our training flyer that lists all of our stuff. That way he can send it out to you guys. But we're looking at doing 5 trainings in total by region. They're going to be completely virtual, completely free, 2 days each, 6 hours each day. So kind of intense, but we're looking at offering in between 9 to 13 and a half CEUs for these trainings. And anyone, again, I encourage everyone in a community to attend these trainings. And then
just so everybody here at the meeting knows, just real quickly, we're Region 2, and I'll make sure I send that out to our people, just so, because sometimes the region gets confusing based on how it's broken down. Sorry, Ambrosia, go right ahead.
No, you are good. Thank you for including that, because that's something I always try to tell people, is show them that map, and that way they can see what county and what region, what county they're in and where their region sits. But another kind of our half component to our project is we're going to be doing these comfort bags for kids. So we're going to be giving out 14,400 comfort bags for kids. And they're going to be specific to youth and teen bags and English and Spanish bags. And so Christina has been the best help in terms of helping us get our materials done for our Spanish bags. And so we didn't want to make these bags grief specific. They're more along the lines of social emotional learning for kiddos, because we're going to be giving them out after our Threads of Hope training. So people that attend these trainings, we're going to be teaching the application of these materials. And after the trainings, we're going to be giving them out to our natural helpers for them to be able to distribute to the kiddos that they come into contact with. Again, they're not grief specific, because we are going to be giving them out with the Handle with Care initiative trainings, which I'll just go into Handle with Care really quick. But if you guys aren't familiar with Handle with Care, this was an initiative that was started back in West Virginia in 2009. The Drug Endangered Children Alliances, specifically in the state of Illinois, have been really big on promoting this initiative and getting communities to establish it. So we're kind of jumping on the bandwagon and doing the same. But basically, it's an initiative that was created to help vulnerable children through simple communication and partnerships between law enforcement, educators, and mental health providers. So basically, I like to say, if a law enforcement officer goes to a home one night and there's, say, a domestic violence situation between mom and dad, and little Timmy is kept up all night, and the next morning little Timmy has to go to school, basically, law enforcement would use their best judgment. And if there is the Handle with Care initiative established in the community, they would then, after they would leave that house that evening, send a message to the educators at little Timmy's school and say, handle little Timmy with care. And from there, the educators would be trained on how to best respond to little Timmy if he's acting out or falling asleep in class or things of that sort. So we're super excited. Sorry, that was really fast.
That was
Very,
great.
very fast. But that's all about Handle with Care. We encourage everyone in a community to get involved, just because you never know whenever a kiddo will see you as a trusted adult and want to, tell you about their story or any experience that's happened to them.
Thank you so much, Ambrosia. We do have a couple of minutes left here. If anybody has any questions for her, you can definitely raise your little hand and I can call on you. Or if you've got like a event or program of your own you want to shout out with the last couple of minutes, we can use it that way too. And Ambrosia, you put your contact info in the chat too, right?
Yeah, I did earlier, but I'll do it again.
Yeah, why don't you drop your email again, just to be on the safe side.
Absolutely.
Jared, can I mention a GPS event coming up?
Absolutely, Gilda.
Thank you. Thank you. What an impressive group of people you had presenting today. Thank you so much. Impressive. So I organized the GPS Parents Series, which is a free virtual event for parents everywhere. There's a special event I want to mention next Thursday. John Duffy, who is local, has a book called Rescuing Our Boys. He'll be talking about boys and girls. It is virtual. It's next Thursday. It's also in person. It's in person at the Glen Ellen Public Library next week at 6:30 with a resource fair. If you would like to have a table at the resource fair, please email me, Gilda_Ross@glenbar.org. Gilda_Ross@glenbar.org. It will be a great event, and I'd like to showcase the important work that you're all doing. Thank you so much.
And when you go out there, Gilda, take a look at the really nice, shiny Narcan wall box we put in the Glen Ellen Library. Very, very happy to have done that for him. I did see a hand from Paul. Paul, do you have something you want to shout out?
It's Gilda, not Glinda. Oh, that's a lovely name. It's Gilda, Gilda.
Paul, go right ahead, buddy.
Yeah, thank you. I was in person last time.
Yeah.
I had a great time, love it. And shout out to my instructor, Bruce Seawick, who recommended you guys. And I think it's a great group. I really do. But I wanted to share that this coming Saturday, the RecoverCon in DeKalb is happening. So for those of us who are going through CRSS or basically CRSS, students or those interested in CRSS and recovery and support groups and recovery support specialists. The CRSS Con, the Recover Con 2024 is happening this Saturday in DeKalb. Feel free to Google it on the Bing and find out more about location and accessibility, but it's free, so can't go wrong with free.
Great. Thank you, Paul. Thanks for coming. Ian, you got something to shout out?
Yeah, thank you. I know that Christy had included a lot of our
yeah, let me share my
stuff,
screen because I actually do
and then
have it
the,
pulled up. Hang on one second here.
and a lot of
I
the
didn't
other
forget about you
side,
guys.
and a lot of the other side meetings that we have. So we've included not
Yep.
only recovery meetings, but there's also some grief
Why don't
reports.
you walk us through these while I have them up on screen?
Yeah, sure.
Can you see it?
Yeah. So this is our the 2024 annual gala. I think I have a better thing that I could. Oh yeah. Please come check out some stories of recovery. We have some compassion, going to be some food, live entertainment, and it's about promoting these inspiring recovery stories. It's going to be at the Dole Mansion, which is a really cool place. It's a historical place. If you're interested, check it out, Crystal Lake. And then we have some more support groups that are added. Let me see if could you make that a little bigger for me?
Yeah, hang on one second.
Thank you.
We have AANA meetings, CA, we have CODA on Sundays,
Mm-hmm.
and Smart Recovery and Refuge.
Yeah,
Awesome.
So we got a bunch of different modalities, and not to mention the family support group, the grief guide, and the CODA. So we're trying to kind of put together some different forms. And while I'm on the topic of the other side, so every Friday night at 8:00, we have an open mic night. So a bunch of people come together, man, to jam out. It's really cool. Every third Thursday of the month, we have a poetry night there at 7:00 in the back room, which is like, it's always packed. It's really cool. And then every Saturday night at 8 p.m., there's live music that comes in. So, I mean, it's a vibe, man. It's really cool. And then the last Saturday of the month at 8 p.m., we have a comedy night. So guys will come in, comedians will come in all across, and it's they just ask for donations, right? So it's kind of on them. They just come in, they provide us a really cool service. And like I said, the place is packed. So get there early.
All right. Well, thank you, everybody. And I'll share these flyers when I send out the follow-up email to my email list. So I'll include all of this stuff. So thank you guys for sharing everything. And yeah, the next ROSC meeting, third birthday party ROSC meeting will be on Wednesday, November 13th. We're going to be talking about substance use and mental health programs for justice-involved people and our friends who are still incarcerated. And then in December, I can't believe it's happening already, the third annual holiday party. Danny, did I attend the last one or was it 2 ago? I feel like I'm jinxed with this holiday party. I haven't been able to attend every party I want to throw for us, but hopefully I'll make it to this one. But yeah, thank you everybody for attending. If you've got programs or anything you want to present on, any topics, we're always happy to have people on. So just give me a shout and hopefully we can feature you at a future meeting. I'll hang around here for just a second in case anybody has any questions, but otherwise have a wonderful Wednesday and we'll see you at the next one.